Today is a very special day on Sushi Talks because up tak ke Manipal ki most dynamic personality has come on the podcast. So I would like to introduce you to the Deputy Director of Student Affairs, Associate Professor of Anatomy, one of the best teachers जिनके through मेरे को मतलब पढ़ने को मिला. A very dynamic personality, one of my favorite wardens also, and a father figure to a lot of students around Manipal. Sushi Talks with Dr. Arvind Pandey, sir.
Thank you, Susan, for this nice introduction.
Sir, आप associate professor है anatomy के. Sir, what do you like the most about this subject?
First thing, what I like about anatomy is to interact and I can say receive first year medical students because they'll be totally fresh with new ideas and first time they come from their comfort zone to medical college. So interaction with them, teaching to them is really something different. And I think, Susan, you know about it, right?
Yes, sir. Sir, but when we enter the DH and we look at the books, इतनी बड़ी books होती है, and it is a very overwhelming subject to study. So, according to you, how should first year approach anatomy?
Yes, this is very actually interesting question because what happens maybe 1 in 2 years will be extensive studying for the NEET exam to come and get MBBS seat. So first thing we have to remember, you should not compare your plus 12 thing to the professional medical college first year, right? And yeah, this college is and this subject or what we say, this course is demanding. So always what I say, focused on your main goal, at the end what you want. And slowly we have to fix targets, small steps. Like first we can say at the end of your MBBS what you want. And then how we want in the first year, then further in the first sessionals, like that. So always I say, no need to be like a book bomb. You have to be like very open. Try to achieve whatever you have fixed the targets for a day. If not, by the week, you should able to complete your portions and whatever topics we have taught you. And in anatomy, always we say, seeing is believing. So no need to mug up the things. Because now you are in the professional college, try to understand the concept, try to, anatomy especially, try to visualize the subject, and again, have fun, because this is your one of the golden period you are going. So I think I say approach sportively, talk to the teacher if you are having any problem. I will tell you how to go about it, because everyone is different. But again, I will say learning with fun. Learning should not do with stress.
Well, very well said, sir. Sir, as a teacher, when you are checking our amazing जो test हम लिखते हैं, what आप 4 out of 4 marks किन questions के लिए देते हो? According to you, which is the best answer for a question? क्या चीजें होनी चाहिए उस answer के अंदर?
See again, the pattern will be totally different if you'll see in the plus 2 and the medical schools. Will very specific questions we ask. Generally, we'll say case-based questions and will be like what we want is it's already well written in your questions. So whatever we have asked, those things only we write point to point, whatever we have asked for. And actually not said explain this, describe this. We'll say describe under following, explain under following. So it's very important to do the justice of the questions. You should know the time management and marks value, like 4 marks question. Something we have asked. No need to go for writing pages and pages, because you'll not get more than 4 marks for that. Right?
I remember one thing. अभी भी याद है sir. It was my first sessional. मेरी anatomy में first year के end तक distinction आ गई थी, but मेरे first sessional में there was this question deltoid ligament, and मुझे नहीं पता था deltoid ligament क्या है. तो I said it's a ligament in the leg. But I said it's in the shoulder. And I wrote half paragraph full, 1 page ki deltoid ligament, it helps in maintaining stability of the shoulder joint. And so I understand what you're saying, sir.
So be specific and write what we have asked for. Okay, and do the time management when you are writing.
Sir, why did you choose this branch?
Yes, so first thing, I like teaching and I like to be with young generations. And something knowing about yourself. It's not like something you are doing that is not related to you. So knowing yourself, knowing your body, knowing your structure, same time, as I told in the beginning itself, I like to interact, talk to my students, and always will be fresh because they have totally pure, and once you discuss with them, you'll get a lot of ideas, and basically they are the foundation of our young generations. Yeah? Our India, we say, we are a youth country. And when you are shaping the youth country or youth in your school or in your college and interacting with those fresh minds is always give you something that what we say, that feeling of be content, and you are contributing something. I think Sushan, you know about it, right?
Yes, sir. I'm today wearing my scrubs all because of Dr. Arvind Pandey, sir. There have been a lot of instances where, I would say my career was also on the line, and sir has helped me out in those situations also. He has guided me and a lot of other students around Manipal, and thank you so much for that, sir. Sir, but let's say somebody wants to take anatomy as post-graduation. So what is the life of an anatomy resident?
Yes, so usually, generally people don't take anatomy in the PG and things like that. But still, this is one of the basic subjects. And if you are much more interested about the anatomy, a lot of things we can explore. Like teaching is the main thing as we are choosing it. So other things is a lot of research happening now related to the anatomy, because this is one of the basic medical science, and a lot of integrations now. Not like we are doing some research or doing some activities. It's not like only about the anatomy. A lot of integrations, because any subject or any health sciences is incomplete without anatomy. So once we know anatomy in detail, you can collaborate with any subjects of the medical science. And even now we do the integrations or collaborations with the biomedical scientists, biomedical engineers. So a lot of things are there to do. As we summarize, teaching, research, innovations, and a lot of collaborations and administrations we can go ahead if you have anatomy, because you are interacting directly with the students. And once you become administrator related to the college and university, you know in and out about the students. That gives you a lot of insights to plan policy, to plan curriculum, to plan the college activities. So this is one of the, I think, if you are interested for the teaching, interested about the human structure, you should join. Otherwise, again, I tell my students, whatever you do, any subjects, every subject is good and fine. You should have passion about it. You should have dedication. So you will not feel tired, you will not feel bored, and will contribute something for the next generation.
Very well said, sir. Sir, what are the most fondest memories from your own DH?
Yeah, always DH is something happening place, and I know my students miss DH once they go to the higher years, like second year, third, professionals years. Even after passing out, they have a lot of memories for the DH, and for us again, every batch is unique for us. And once in the DH, they are totally again new to the cadaver. So we start the day with something called cadaver as a first teacher, as our module.
Yes.
And we'll sensitize how this cadaver is important, and how these people who have donated their body for the, again, greater thing, greater interest for the humanity and the doctors. So a few days will be little emotional, because students see the cadaver the first time, and they have a lot of questions in their mind, because this is something like transforming phase for them. Always I say first 3 months or first year is transforming phase, because they've come from the school to the college and that professional college. Second, first time they're coming out of their comfort from their house, because the house everything is there. Now they have to do by their own. Usually in college, we generally don't interfere if they're not disturbing others and not obeying the rules. Usually what happens, this transforming, again, age-wise also, they will just 18, 17, 18, 19, 20 now. So something age-wise also they are transforming. Emotion-wise also transforming. Learning-wise also. So this phase is something I say Amrit Kal. Because if this phase you are handling very smoothly, I think in those DH time will get almost 2 hours time, 11 to 1, and depends that things. And these 2 hours, other than even discussing about the anatomy, about the body, and all other things related to in and out, they're transforming. And every student have their own questions, unique things. And we make a lot of bonding during the DH.
Yes, sir.
And this bonding will be something different. I will cherish this bonding. And always I say the DH hour is the best time, but I celebrate or what I full day. And always I wait for the next day when DH will come. Even students also,
Yes,
they they wait for when the someone who is like very close to them and they can discuss anything that. And always I believe students know. Just we have to tell them what to do. If they believe you, they trust you, they know this person is not going to harm this person is for you, for your good thing. Always they listen you, and later
one of my closest friends were those only जो अभी तक मणिपाल में हैं, were those only that I were in my DH group. And I still remember that we used to just wait कि when will Arvind sir teach us? You taught us abdomen and pelvis, and thanks to you sir मेरा सबसे ज़्यादा clear वही है. आपने काश मेरे को head and neck कराया होता. तो head and neck is a very difficult part. अभी तक I face trouble in that. Sir, if you're not good at anatomy in first year, so can you be a surgeon?
See, again, as a student, as a doctor, always we believe, as a academician also we say, कि you have to be lifelong learner. This is one of the basic thing. जब जगो तभी सवेरा हम बोलते हैं. जिस दिन लग जाए, जिस दिन तुम जग गए उसी दिन सवेरा है. It's not like आपने first year में नहीं पढ़ाई किया, so it doesn't mean that कि whole life you are going to struggle. The day when you started feeling, no, this is required for me, and you can do wonder. And I have seen a lot of students, it's very difficulty they have cleared first year, very difficulty they cleared anatomy. They are doing wonderful job in different parts of the world. So always I say कि जितना जल्दी जगोगे उतना जल्दी तुम you achieve your goal. But it's possible. We can be. If you are not now, doesn't mean that you will never. Anytime you'll feel that we can do, you can do wonder.
Yes, sir. Sir, as an associate professor with so many years of experience in teaching, what books do you recommend? So because we have a lot of books we have Nita Kulkarni, we have B.D. Chaurasya, we have Grey's Anatomy, Netters, and most of us even use selective anatomy also. So what according to you is the best book for anatomy?
Yes, Sushan. Actually, we have something recommended books, something called reference book. So everywhere we update as per their requirement and all. So usually what I suggest my students, so book is just for your one of the way to understand the topic. So you see which one is good for you. So nowadays we're recommending Vishram Singh or B.D. Chaurasya. So among them, if you feel that by reading that B.D. Chaurasya is good for you, you read that. You feel that again Vishram Singh is good, you do. But always what I say, sometimes what reference book we are telling or recommending book, if some topic you're finding that is very short and sweet, we want more, always go for higher books, Grace and further. But because we have very limited time, we say for 1 year professional course, but usually within 8th and 9th month we are going to complete. We have very short time and we have to read physiology, we have to read biochemistry, other than also we have a lot of other assignments. So try to understand the subject. You can read whatever recommended books are for you, and always DH and practical, utilize those time. Because in the DH and practical, whatever I do for histology and all, this is one of the best time, as discussed earlier. There, everything will be clear because teacher is with you, cadaver is with you, bone is with you, and all friends. So what we can do this time, you try to visualize how the things are there in the cadaver. Again, same thing you try to visualize in your books by diagrams, by the videos, but make sure that we have understood. Because once we have understood the subject, the topic or structure, anyways, whatever things we'll ask you, we are able to answer it. And this is the best way, generally what we say. In the lecture class, when we are coming, maybe you are not understanding all things, around 20 to 30%. But again, we are coming to the DH, your 30% will become 60%, 70%, because we have understood this. Then I suggest go back and read that topic, try to visualize it, and again, next day, you come and see those structures, discuss with your friends, and speak it out. You try to explain those structures by your understanding and make your own mind map, your concept map, your diagram by understanding, your own flow chart. This will give you long lasting memory and same time understanding in depth. So these things you have to follow, and I'll ask my first year students, if you're watching me, First thing is, in the lecture class, be an active listener. Maybe you're not understanding everything, but try to find out the keywords what teaching is repeating. First, in the lecture, active listener. Then second thing, in the DH, full attention you pay. And third, try to visualize in the cadaver. Then going back at hostels, try to read the textbook. Again, try to visualize with the diagram, videos, images, and whatever we have seen in the cadaver. Come back again, see those structures, try to visualize again, and have discussion with your friends about these topics. And we see the clarity. And make your own diagram, make your own map, make your own mind map, okay? When your own flow chart. And you see the changes. You start loving anatomy.
One thing I love about our DH, specifically in KMC Manipal, is that we have a lot of blackboards and chalks also, har cadaver ke side mein. And I remember making the brachial plexus at least 5 or 6 times, and the lymph node drainage around the breast. And now it is like, I don't remember brachial plexus properly, but I remember, yeah, root trunk division अच्छी तरह बनाया था, पूरा सब किया था. It really helps when you are practicing on your own.
Yes, and generally say something with the some mnemonics. Hope you remember that.
मेरे को एक तो वो वाला याद है, cubital fossa MBBS and like axillary artery के third part के lateral medial and वो वाला अच्छी तरह नहीं याद, सर मैं गलत हो सकता हूँ, but वो भी extensus hallucis longus वाला जो एक था वो भी वाला basic कुछ चीजें याद है. एक बार देखूंगा anatomy, अभी नीट आ रहा है, तब I'll hopefully do another episode with you, sir, after that. Sir, after teaching so many years, which is your favorite batch? एक होगा ना particular batch कि this was.
ये बहुत difficult question है. Otherwise, after this only, I start getting messages called, sir, मेरा batch ने क्या बिगाड़ा था, आपने मेरा नाम ले लिया. I always say my every batch is something different, something unique, and always once I receive and I get chance to teach those students who are freshers, they are totally different from that the next generations. And always I believe, because as a medical teacher and also I'm a teacher trainer, as a part of medical education thing, we have to be with students. You should know their requirements. You should know their mental level, because you can't compare 5 years before batch to now, because they are totally different. And their way of understanding, way of teaching, the way they interact with you, their lifestyle is totally different. Doesn't mean that they don't know what to do. They know each and everything. They know what to do. Even nowadays, these generations, they plan after 20 years, 30 years what they want, and they do this. And most of these students are well-learned people. So if I say favorite batch, as per now, every batch is something unique, and I like each and every batch, and I always wish them to do something best in their life and contribute to the society.
Yes, sir. Sir, you have a lot of great accolades during your career, like you went to Dubai and you went to a lot of other countries also as an anatomy professor, sir. Sir, वहाँ के teaching, how is it different from ours, and like are the mindset of the students same or different?
Again, if you compare with the Indian students and outside, it's totally different. First thing is, here, I'm not saying all, but majority of the students are basically dependent on the parents. And usually parents is the decision-making factor. They only decide what their kids should do. There it's different. And but nowadays, even our country, a lot of exposures, students know what is good, what is bad. But still, every batch we get few students, they don't have any ideas, simply because someone told them to do this and they do. Later they realize that this course is not for that person. But still, I say this is just undergraduate. You can do anything after just UG. Say like if I want to do something else. Now medical is not only restricted to only one part, to the treating. Even you can do the management, if you can do it for the humanity, even you go for the literature. So now a lot of things are there. So once you are there in the system, you are in the best course, and if you are in the KMC Manipal, you are one of the best college. So utilize those facilities, and later we can see, even you can realize why I am saying you this is the best college and you are in the best hand of any, if you'll say compare with any colleges in India and abroad. Other side also what happens, they have less cadavers. So most of things they do on there may be the mannequin or maybe that virtual things. But here what happens, we have blending. I think Susan, this year we are starting the virtual dissection also.
Okay, sir. Oh, I didn't
Yes,
know about
already
that.
we got it. So
Wow.
2023 batch is getting chance to do the virtual dissection. So even the virtual dissection we have, and we have enough cadavers. Lot of experience learning, lot of I say that even we have the mannequin clinical skills lab, simulations lab. So here lot of teaching materials are there, lot of good dedicated teachers are there with you.
That is
So here if you compare with the others, these all are plus point. You have world class infrastructure, you have world class sim lab, clinical skills lab. We have blending with again traditionals, dissections, also with the virtual things. So these things make you overall rounded, like all rounded. It's not like only book bomb. Even in the infrastructure, if you talk about, we have a lot of research opportunities. A lot of, if you are interested in do the patenting, copyright, innovations, we encourage such things. We have something like called teacher guardian schemes.
Yes.
Mentors and all. So in the beginning, because students are far away, they don't know whom to talk, things. So this teacher guardian scheme is one of the the best schemes what we are doing here. So if you compare with again from there to here, age wise, teaching wise, finally learning wise, teaching material wise, is totally different. And Sushan, you are in the best college.
Yes, thank you so much, sir. But a lot of students have a doubt ki should they choose KMC Manipal or KMC Mangalore. So, according to you, which has more perks when it comes to teaching infrastructure?
So see, again, KMC Manipal or KMC Mangalore, if you'll compare, both are under MAHE, Manipal Academy of Higher Education, and both are actually our flagship institutes, if you compare, because in Manipal, MAHE, Manipal Academy of Higher Education, we have everything, almost all colleges, we have all disciplines, except broadly, if you say agriculture and veterinary. Other than agriculture and veterinary, we have all professional courses. So nowadays, a lot of things are there to compare. If say NIRF ranking, a lot of private people also do the NAC ranking, even India Today, Outlook, and other things they do. So KMC Manipal is the first established institute, if you'll say, around 1953 by the MAHE. And KMC Mangalore is one of the, again, after previously in the first pre-para was they used to do in the Manipal, later Mangalore, now two separate colleges. So both are the best institution. And second thing is, if you'll say Manipal, it is like campus. We have only one campus and we see everything. And this is one of the main starting campus. Mangalore, their campuses are like pre-para one place, clinical
Yes.
splitting wise. Mangalore is a big city. Manipal is now evolving, becoming international town. So teaching learning wise, there is no any difference. Difference is only about the campus and
The lifestyle.
the lifestyle. Otherwise, there is no any difference.
Okay, sir. Before Arvind sir was the Deputy Director of Student Affairs, Health Sciences Department here in MAHE. Sir was the warden of Nehru A Hostel. Sir, it is a headache to handle kids like me, naughty kids like me. And why did you take this responsibility?
First, I was not sure I should take or not. So, so what happens? That time, the dean called me and she told ki, because in the Nehru, a lot of medical students are there, and whoever is the warden now, he doesn't belong to KMC, so we'll be able to take this responsibility. Because I never thought that I'll become warden. So, as my basic nature, then I thought, can I contribute something significantly? I be a warden of this hostel. Then I discussed with few kids who were there in this hostel. They told, sir, आप बन जाओ. सर कुछ भी प्रॉब्लम होती है ना तो पता नहीं किसको बोलूँ क्या समझ रहे हैं आपसे तो रोज मुलाकात होती रहती है एंड एवरी डे वी डिस्कस विथ यू एंड कम एंड टेल यू द प्रॉब्लम सर आप बन ही जाओ देन दो तीन बच्चों हम सोच सकते ऐसे ही बोल रहे हैं क्योंकि दे आर क्लोज टू मी आफ्टर दैट लंच ब्रेक इन द इवनिंग around 30 to 40 students from that hostel, they came to me. एंड सर सुना है कि आपको वार्डन के लिए बोल रहे हैं, आप सर कंफ्यूजन में मत रहो, प्लीज़ बन जाओ. देन आई टोल्ड ओके देखते हैं. एंड आई टोल्ड दैट टाइम डीन कि यस मैम आई एम कंफर्टेबल एंड आई विल टेक दिस रिस्पॉन्सिबिलिटी. And I become the warden of that hostel. Actually, warden terms means they think there is not a good connections between the students and the warden. People think that warden will be like jailer. इतना सारा रूल रेगुलेशन बता के रखेगा, डांटेगा, फाइन करेगा और नॉनसेंस ऐसा होता रहेगा. देन फर्स्ट थिंग मेरे दिमाग में आया कि यार बच्चे सुनेंगे नहीं तुम्हारा. प्रीवियस वार्डन और पहले लोग यार बच्चे बहुत बदमाश हैं, तुम्हारा नाइट स्लिप जाएगा, रोज रात को तुम्हें ना फोन आएगा, ऐसा हो रहा है वैसा हो रहा है. देन आई थॉट ओके देखते स्टिल विल ट्राई बिकॉज एक्चुअली इन द एज एकेडमिशियंस तुम प्रोफेसर हो तो बच्चों से जो बात करते हो इन द DH और इन द क्लास इन द लेक्चर इट टोटली डिफरेंट एक्सपीरियंस इन द हॉस्टल बिकॉज इन द हॉस्टल्स दे विल बी इन देयर ओन. सो first thing what I thought ki I should be very open to my students. Open means they should come and tell their problems, and whenever they feel problems they should not hide. Feel that ki something is not good, something is bothering, anything. They should feel comfortable and confident ki if I'll tell to sir, sir will do something. And he will take it at least some little higher level or he'll try to solve that problem at that level only. So that was the good one. Then next it was like because sometimes what happens actually we recommend to be take Nehru because most of the KMC students are staying there and it's a double sharing one. So most of the time now what is happening, we have single child and child has a lot of things at the home but first time coming to the hostel, so adjustment issues with the roommate. This is a very natural one because I told first time they going to stay with someone in the room, and as per today or they were single room because single child, all attentions to that kid itself. Once they come to the college and the hostel, they have to compromise, they have to adjust, they can't do anything whatever they want because there is some rule regulations they have to follow. So if we'll give time to them to get adjusted, if they try to understand, if we'll counsel them, talk to them in those period, usually I say first 3 months, it will be wonder because they learn not only subjects and clinics, they learn how to lead a life, how to get adjusted in adverse situation, how to take decision when parents are not with you. So their personality totally used to get changed.
Yes.
And once they are comfortable with their own, otherwise they think that I'm doing something to impress someone. But now what happens, ownership on them, ki how to take my life in the next level. And as a warden, your role is very much significant because you are teacher also and same time you are a warden also. So you are the only person who knows about the kid 360 degrees.
Yes.
That gives you something different perception when you are discussing with the kid, when you are talking to them and you are knowing them. Because something goes wrong to the person, to the hostel or in the family, coming to the class, the person will not the same. And if you are scolding because something he didn't answer or something he didn't complete, you don't know the background, you don't know what happened, you may do again damage and something wrong to the kid. So then I felt that my response is much more than simple warden and the teacher because students are feeling so much comfortable, confident and saying ki sometimes their house problem, their home problem, their friends problem, their relationship issues, they're not able to adjust with the academic environment. Sometimes they're not able to cope with the whatever is a demand or requirement as a medical students. If the person is not well disciplined, something goes wrong, they used to get distracted. Once the person got distracted, difficult them to
Come back.
And coping mechanism, what happens ki they'll go coping mechanism in such a way that ki if I start doing this, it will be all right. Maybe drugs, alcohol, smoking, or maybe any bad habits. So as a warden, our job is make sure the student is comfortable and his distractors should not again damage him, and you should be able to identify their distractors and you should be able to counsel them, monitor them, and same times we are not a jailer. If small mistakes they are doing, you should not be that much things. You can ask why this person is not obeying. What is their mindset? Once we'll talk to them, we'll come to know okay, due to some reason or maybe something fun, they don't know the consequences, it will become like that. So sometimes they'll take it so much granted, I'm doing that is just a fun, what happened? Nothing will happen. And they don't know consequences because just they are in the transforming age. They have never, maybe they are influenced by some movie, some friends talk, maybe by some alumni or by anyways, we can do this in the hostel. Once we'll come to the campus, we can do this. But again, you can do, but anything you should not do that harm you and harm others. So it's very, very important to understand it. And again, as a warden, I enjoyed my tenure, and hopefully, I was not labeled as a jailer one because I try to understand my students and I try to be with them. And I think you can ask. I think you are also in the hostels. You can do the better how the experience.
सर मेरा एक्सपीरियंस इन ऑल दी हॉस्टल्स सर मतलब मेरे पास वो एक मैं अपने आप को यूनिक सिचुएशन में मानता हूँ क्योंकि आई हैव स्टेड इन नेहरू ए हॉस्टल, नेहरू बीएनसी हॉस्टल, अमर्त्य सेन हॉस्टल ऑल्सो एंड लाइक आई एम शिफ्टेड आउट टू अ फ्लैट ऑल्सो. सो मेरा जो वो ये जो 5 years का था इट वॉज वेरी डिफिकल्ट टू अडेप्ट विद ऑल दो सिचुएशंस बट आई एम वेरी हैप्पी कि मैं वो कर पाया. सर मेरे आई एम सो सॉरी फॉर ट्रबलिंग यू ड्यूरिंग माई नेहरू ए हॉस्टल डेज. आई एम रियली सॉरी टू डॉक्टर विनोद नायक सर फॉर ट्रबलिंग यू इन माई नेहरू BNC वाले ईयर्स. आई एम रियली सॉरी टू डॉक्टर मोहन बाबू अम्बेडकर सर जिनको मैंने आई थिंक अमर्त्य सेन में सबसे ज़्यादा तंग किया है. मैंने लाइक मैं ये नहीं बोलूँगा मैंने उनकी रात की नींद खराब करी है बट मैंने उनका दिन का चैन बहुत खराब किया है मोहन सर को तो. बट सर अब जब KMC मणिपाल कोई फ्रेशर ज्वाइन कर रहा है आप उनको नंबर 1 एडवाइस क्या देना चाहोगे?
Again, it's very important one because if you see in our campus, we have 250 students, and out of this 250, around 90% of students are from outside, not from Manipal, and they know about the Manipal, especially KMC Manipal and Mangalore. They know this is one of the best institution for the medical training, and they know कि here we have the world-class infrastructure, global level training, and our teaching learning curriculum is par excellence. We have everything. So again, to get KMC Manipal is not an easy thing. Once you are in Manipal, so generally I say सरस्वती और लक्ष्मी दोनों की कृपा होनी चाहिए. सरस्वती की कृपा है तो नहीं होगा, लक्ष्मी दोनों मिलके होना चाहिए. So लक्ष्मी कृपा मतलब कि तुम्हारे पेरेंट्स शुड बी एबल टू अफोर्ड यू एंड तुम तो ब्रिलियंट होना ही चाहिए एंड यू शुड बी सिंगल गोल कि आई हैव टू बिकम ए कॉम्पिटेंट डॉक्टर. सो एडवाइस के लिए मैं क्या जनरली कहता हूँ कि नाउ इट इज़ लॉट ऑफ स्कॉलरशिप्स आर ऑल्सो देयर. सो इफ यू आर गेटिंग गुड रैंक in the NEET exam for the KMC Manipal, we don't charge a single paisa. It's free of cost. I think at the last of this, we can give you a link to understand about Manipal. So our website and all details, I think ask Sushan to share in this thing. So they will be knowing where to search for those things. Advice number 1, be focused. Means for what thought you have come to KMC Manipal. You should be very clear. Number 1, be focused always, I say. List your distractors. Within 10-15 days, you will be knowing what things is distracting you. So maybe distractions for someone is mobile, maybe for distractions someone is extra time, sometimes bad habits, sometimes relationship issues, sometimes not able to concentrate, maybe something. So always I say identify your distractors. And these distractors will, it's not like in 1 day, 2 days we are going to solve it. Once you identify your distractors, you know how to take it because you know yourself better. So try to avoid it. Third thing, whatever because you are freshers, try to explore the facilities given by the institution. Because whatever facilities we are giving to you, whatever infrastructures are there, this all for you. So at the end, it should not feel like, oh, I have not utilized this much. These things were there in the KMC Manipal, I could not do that. So whatever facilities are there, you try to avail it. At least try to see it how it is. Fourth thing, time management. The time management is very, very important because if you're not managing time, you will not able to perform it. Because morning to evening we have classes and we teach, we conduct examinations that also very frequently, and we give homework. We'll give you some assignments because it's not like you are no one is there to observe you. We are here to observe you, and within minutes uh, we'll come to know you are not physically, mentally fit
That is true.
because of we don't know what issues you are going through. So if you have any issues, you feel that during your beginning days of KMC Manipal, anything is bothering you, whatever it is, try to report it. Even if it is not with you, if you're finding that case, someone else is going through this type of issues and the problem, something, anything abnormal, report it. We are here to, again, solve those problems, and we are expertise. We have counselors, we have teacher guardian schemes, we have mentoring program, a lot of things are there. So you can take advantage of that, and you can do wonder. I can assure you. Again, if you are doing something adventurous, especially I say because you are coming from the North India and other parts, where most of us have not seen the that much beach and all,
Beach and everything.
beach and everything. So what happens? Ki will be so much excited. Even I was so much excited when I saw the first time, and that is so close, and beach is very nearby. And KMC Manipal is blessed by again a lot of good sceneries, nature, and pollutions wise also this is like we can say a lot of greeneries and mountain, beach, a lot of trekking, a lot of good things, temples, a lot of things are there in around. So especially I suggest freshers when you are adventuring those things, don't do something life threatening, risking thing, especially a beach area. If you are swimmer also, this beach is not for swimming. Don't try it because every year we lose our 1 or 2 students in this beach. Second thing, road traffic accident, RTA. If you are not confident, if you are not that much keen, actually any vehicle is not recommended in the campus because everything is nearby. Your classroom, your labs, your hospital, everything is nearby. So we have to take care and follow the road traffic rules, especially that helmet, that seat belt, and don't drive
Drunk.
drunk cases because again a lot of accidents we have lost, a lot of students have got damaged, and it should not be a simple we say soft target for drugs peddler because maybe someone asks you to go for party and they mix something to you, they offer something to you, maybe that person looks like very close to you, maybe someone is your senior classmate, anything. So please, if someone is doing like this, you can report, or simply will say no, I am not this, because it's not like only Manipal problem, it's like throughout the world. You should know what to do and what not to do. If you're not able to decide what to do, what not to do, contact your teachers, contact your parents. But your parents have sent you for a lot of expectations. Even as a teacher, as institutions, we have a lot of expectation from our students, and you are here to make your life. So please don't break your life in by doing such things. And rest, as I am again assuring you, if you are able to minimize your distractors, if you're not doing any bad habits, this is the best place and will cherish throughout your life.
वाह सर, मेरे को तो अपनी सारी गलतियाँ आप जो जो बोल रहे थे ना, आपने जो एडवाइस दी है, मैंने ये भी गलत किया, ये भी गलत किया, मेरे दिमाग में ऐसा आ रहा था. I'm so happy कि we talked about this particular thing. If I had seen I have heard all of this एक बार में ना सर, maybe मैं वो faults ना करता. And if the viewer is watching this right now, you guys are very lucky that like आपको एक ही जगह पे आपको पूरा blueprint मिल गया to have a successful journey in Manipal. Please follow it because coming from personal experience, this place is a very small concentrated town, and once you get into any of these distractors, it is very difficult to come out of it, and it requires your parents ka perseverance also, your teachers also, you need to change your friend circle also. It is a task, and you have come here to study and make a career, and all of these things just take you like 3, 4, 5 steps back. Thank you so much, sir, for
I'm
this.
very happy that Susan is now doing very good job, and Yeah, he was notorious. But now by talking to him and because I am watching, I'm seeing him since long, almost last 4 years. And Susan is the best example now, and I'm going to ask him to be a peer mentor, and hopefully he's going to again give a talk how to be careful and how to enjoy your journey and how to make it fruitful during this stay at Manipal.
Sir, I'm honored, sir. Thank you so much. Sir, there is one more doubt a lot of students have. Ki which year I should take which hostel? And they tell their parents, I want to shift out, mama. मेरा हो गया है. मैं independent होना चाहता हूँ. So,
Yes, so again, these questions we get almost every day. So, Sushan, and thank you for inviting me. And so this broadcast may help others. So, so usually what happens in the first year, we have dedicated hostel for the first year. Again, I say we have zero tolerance for ragging and we don't encourage such things. But still, as per guidelines by competent authorities, we have dedicated hostels for the first year. So maybe Nehru A, but I was talking to him. So always I suggest kids or parents ki Nehru A, because a lot of changes, lot of adjustment, lot of fun, and it will happen to them. So it should not be like isolate them to get it, because this is their experience, life experience. If you are saying to them, better feel this experience, ki how to be adjusted, how to be with, because in our hostels or our college, students are from almost all part of all states of India, more than 20-30 countries. So we are almost staying in something like international village. So we'll be able to see people from the different parts, different culture, different mindset, different lifestyle people. So first hand your experience as a diversity. And as a diversity, everyone has come here to what? To do their course, to become a good doctor. So I always recommend in the first year, please ask them to stay, especially in Nehru A. And this is like twin sharing, two kids. So that also help them to, if something goes wrong or something is happening to that kid, no one is there to watch if the person is alone. So someone is there to see person is not well, something is happening. So security wise also it is good, health wise, and also I think for mental health and for
well-being.
coping, well-being, I always recommend Nehru A for the first year.
sir, for like second year, third year, for
Especially for the boys, Nehru A. For the girls, we have Indira Hostel, and again, so many students they ask our parents, kids like same. We have totally separate thing. Nehru A for boys, Indira for girls. There is no any mixing, and timing, curfew rules are there. Not to again to break them, but they should feel safe. And we have curfew hours, so by this time they should be in the campus, and to make them disciplined. Okay, because students are, again I told you, from different background, different cultures. So your enjoyment should not harm
others.
someone.
yes, that is true. That is true, sir. But like I went behind my parents' back and I told them, ki, guys, let me shift out, let me shift out. Do you think it is a necessity to shift out during UG years, or like internship mein to I feel it is, but like what's your take on it?
See, always I suggest stay in the campus, because this is the unique thing of your life. Because after that, you will not get chance to stay in the hostel. You have your own things, flat and all. So enjoy this thing. Enjoy the stay at your. Usually, what happens later, if some person is saying, ki, usually we don't recommend, especially the first year, we don't recommend. Later, if they want to shift by any region, we try to explore it. It is correct or it is not correct. And even we'll take consent of the parents, ki it is required. So if it is really required, case to case, if you'll say, then only we say, ki, no, you can stay outside. But usually I recommend kids, students should stay in the hostel.
Very good, sir. Sir, what are some things you would like to change about Manipal?
Yeah. So I think from 2007 onwards, I'm teaching in KMC Manipal, almost 16 years over. And I feel we are always updating. This is something unique for the KMC Manipal.
Yes.
We are not like orthodox. How world is changing. we also change. And always we plan for the next 25 years, next 30 years. So, if you say the changing something, maybe we should be more towards the digital things now, more digitalizations, more something robot. Our students should be more involved in innovations because they have a lot of ideas, and they should start also startups. And,
Yes, sir. I also feel that.
yes.
Because MIT, there is a culture of
Yes,
startups, but
yes,
like KMC
yes.
does not have that.
So this is something unique for us. We can collaborate because I told you we have in the Manipal we have everything except agriculture and the veterinary. So there is a lot of chance for collaborations. So students should utilize it, and we have now already platform for that. But I want them, our students, undergraduates, to come out from that comfort zone other than their academics and other things, and they should, again, as I already told, contribute something. So startups, innovations, research, and whatever something is going to do the new things. Students should think of in that research ways, and definitely experience learning for them. It's not like something they are only reading. Whatever they're reading, they're trying to apply it, applications-based research, and something we can help our poor people or society or the patient or whatever. So I urge my students to think in that way also and start doing that.
Very well said, sir. So you have been teaching for 16 years now. Yes, sir. So what are the qualities of a great teacher, according to you?
First thing, again, as the students are updating, students are changing, you should also change. Same way you can't teach what you're teaching 10, 15 years before, because generations are changing fast and equipments are changing. So always I say, first, be a good listener. As a teacher, you should be good listener. Students will come and talk to you. Sometimes they will talk, and during their talk, during conversations only, they will have some suggestions for them itself. So try to pick, and always don't force or suggest something as per
Your own biases.
your own biases, your experience and things. Try to understand the students in which situation, which background, how the person is born and brought up. So understanding students is one of the key factors to become a good teacher. Understand him, because every student is unique, and everyone has power to become a best and to do something better. So now the person is in the problem or some things not doing doesn't mean that whole life is like this. No. Please understand. Second. Third, always teaching should be as a fun. So try to teach students not in sarcastic and fearing ways. Always, whatever topics you want trying to tell or teach, make them as something interesting. So students feel like, I have to be in this class. I have to go for this class. Then no need to beg, no one is there for my class. No one is coming to my class.
No, we were very excited. We were just always waiting. When will Arvind sir come and teach us like in our DH, sir? It was.
Yes. So these things will make you something different. And students, again, you should be very clear what you want to tell. So communication should be very much clear. And second, students should trust on you. Students will feel that he is here, I am safe and secure, and whatever he is saying, this is for me. This is for me. So that bonding will make you something different. And students, not only in the first year, they will be with you till their last memory. Someone is there in the anatomy, because anatomy we teach in the first year. So if you want to make your students a good learner, good human being, be good to them. If you respect them, they will respect you. If you will understand them, they'll give value to you, and they will wait for you. I'm just telling you with my experience. So just you try. I'm just this last message for teachers.
Sir, we'll end the podcast with one last question. As a teacher, which is one of your fondest memories?
A teacher, because I enjoy my teaching. I enjoy conversation with my students. And it's not like only teaching hours, college hour. Even we discuss and interact after the college hours. And I cherish it. I enjoy it. Susan asked me one, so difficult, but something I was remembering now, so I will try to tell this. Yeah, so I went to the, again, Mangalore airport to receive someone, some VIP from university side. And in the same, in the airport itself, same flight, a lot of my students were coming after their vacations. And as I told you here, around 80 to 90% students are from outside. So around more than 50 students were there in the same flight. And I was with the bouquet to receive someone at the airport, and my students were again coming out from the things. And I forgotten that I have come to receive someone here. I got involved with these kids, and they were full around me. And actually, what happens? Basically, if especially the north part, and if your students will touch your feet, and these all students were touching your feet, and they are hugging you, they are discussing with you, and I got involved with them, and and they started talking, conversing. And this chief VIP guest at the Mangalore airport, he was saying, who has come to receive me? And then the driver told ki, the person who has come to receive you is with these kids and 50, 60 students around me. Then suddenly I realized, I have come here to receive some VIP. Then I told this kid, he will talk to you again when we'll be in the KMC Manipal, in the campus. I've come here to receive someone. Then this person was from outside of India. And then simple conversation, he told, how are you, what you do, like that. In the next, when we were meeting to our officials, he's saying, ki, you have sent someone to receive me. That person is hero of the campus.
He's not wrong. He's not wrong.
Because he was like something. I have never seen students will be around like that. He's so much comfortable. Students are so much comfortable to them. When I was walking with him in the campus later also, a lot of students are coming and discussing, saying their problems, saying their things. So as a teacher, this is something I have never thought of. He will tell and students will happen. This is something natural. And still, I'm talking to you, I'm feeling, oh my God.
Yes. So, ये तो सुन के like I'm also like very cheered up. Sir, Arvind sir, this was one of the best like episodes till date which I have conducted on Sushi Talks, and I just thank my stars ki like I got this opportunity to sit next to you and talk to you, and we have like shared a lot of information today, and hopefully it will help coming generations of students also when they watch this video. Thank you so much again for giving me precious time, sir, and Sushi Talks will be airing soon. Thank you so much.
Thank you, Susan, for giving me this opportunity, and I enjoyed this. Thank you so much.